So now we move on to a very important issue for health and reproductive justice. And we welcome Kathy Hart, who serves on the Health and Reproductive Justice Committee on the General Board for Church and Society.
Here it is.
Thank you. I hope everyone can hear me on my computer. We're going to talk about the reproductive health care, and one of the things that I think is worth mentioning that Sharon Delgado already mentioned is Wesley's statement, "Do no harm, do good, stay in love with God." Our church a couple years ago read "Our Purpose is Love" by David Fields, who was on the Way Forward Committee, and it helped us to understand the differences that we have in our congregation about reproductive justice and about the LGBTQ issue, which are dividing our church. When in 2018, when I was about to testify before our state legislature on the 20-week abortion ban, I went to our social principals. I wanted to know what they said. And I was kind of surprised because I think that they could be causing harm with the language that we have. And I thank Reverend Dr. Moore for being a co-leader on, revising the social principles. But there are a few things that I think need to have some tweaks. So I'll go over some of those things. There's language in both the 2016 and the 2020 revision that are not medically accurate. And to me, as a provider, a medical provider, I think can cause harm and can cause confusion for clergy who are counseling women and birthing persons. And I do think we need to address language in the future, birthing persons, not just women, because we have non-binary and trans women who are having babies. But there's harmful language when we talk about late term or partial birth abortion, which are not medical terms. And this is the statement that is currently in our social principle. We oppose late term or partial birth abortion, a process known as dilatation and extraction. We call for an end to this practice, except when the life of the mother is in danger. No other medical treatments are feasible or when severe abnormalities threaten the viability of the fetus. Dilatation and evacuation, D&E, is a procedure that we use in the second trimester and early third trimester for fetal demise when we've lost a pregnancy for many different reasons, but it's also used for terminations that are necessary to save the life of the mother. And it's safer, it's the safest actually procedure than putting someone into labor and have an extended 3 or 4 day process. There's also a statement about pregnancy crisis pregnancy centers or pregnancy resource centers. And I'll talk to you about that a little bit further. Here we go. So crisis pregnancy centers are nonprofit organizations that present themselves as healthcare clinics while providing counseling explicitly intended to discourage and limit access to abortion. They engage in purposefully manipulative and deceptive practices. They are coercive, and they spread misinformation on sexual health and abortion. They have been shown to delay medically legitimate prenatal and abortion care and negatively impact maternal health. Along with increasing anti-abortion legislation, they have tried to close abortion clinics and exacerbate ongoing harmful impact to the reproductive landscape. I do not think, and the medical profession does not think that we should be supporting these centers. So I went through some of the trigger terms that we've learned about from the American College of Obstetrician and Gynecologists. dilatation and evacuation is, as I mentioned, is 13 weeks of pregnancy. And it's used for many procedures other than, in addition to an abortion that someone has decided for other personal reasons. And it's really not my business to judge why someone is choosing to do that. But it's more important that we give, as medical providers, all information, accurate, factual information, and help them to get to the right people that they want to help advise them, whether it's their pastor, their family, other counselors, so that they can make an appropriate decision. It's a safer and more effective, as I mentioned, than labor induction for fetal indications. The crisis pregnancy centers have been determined to be unethical by the American Medical Association and American College of Obstetricians and Gynecologists. And as I mentioned, their goal is to and particularly target vulnerable people and populations that are already having gaps in care and disparities and are marginalized. And they offer free things like diapers and things like that to lure people in, but then once they have the baby, they're not there for them. And again, they actually are now advertising that they can do abortion reversals, which are not safe, recommended, or effective. This is really not a medical treatment that can happen. Partial birth abortion is also in the language of the social principles, and this is an inflammatory term. It is not done, and it's not a medical term, and it's outlawed, even though it's not a real medical term. It's been outlawed in 2003. I think that language needs to be removed. Late-term abortion also is not clinical, and it doesn't happen during this period. It's abortion later in pregnancy is referred to by weeks of gestation, 14 to 20 some weeks. In most states, there is a ban after a certain period of time, and only 1% of abortions take place after 21 weeks of gestation from the last menstrual period. These are almost always, and in my experience, completely because of either a mother's life is in danger or there's severe fetal anomalies. And we give women the option to either continue the pregnancy, and we will do palliative care. We are not going to revive a fetus when they're born that is incompatible with life. And that's a decision that's also made with the family and with the sometimes the ethics committee at a church, at a hospital, and then neonatologists. So they get palliative care. And the other terms that are in there are baby, unborn child, or preborn child. And these words have been used very significantly to cause significant harm to women and to their families. Just recently, and a couple of days ago, the Alabama Supreme Court made this decision about embryos being children. And this is causing a major uproar in vitro fertilization. The other things that we've seen going on for years in my state in Wisconsin are the personhood laws, which allow for incarceration of pregnant persons for substance use, miscarriage, legal prescription medications in Tennessee, and that causes severe trauma. I testified in federal court for one woman that was put in solitary confinement in a jail in Wisconsin because she was taking some medication that she should not be taking. This is extremely harmful. The mother does not get an attorney, but the fetus gets a guardian ad litem. And in Wisconsin, if you are pregnant, you lose your rights. There are a number of other petitions that actually the revised principle is really quite good. And I understand that we want to have that approved, but if we could amend those statements that I mentioned earlier, that would make it more factual and less harmful. The other petitions that are dealing with this issue, I would vote no, and they are really just restating some of the revised principle and adding some actually worse language. In part 3, volume 3, some new things. There's one that Mary Larson has proposed, and it's really a nice summary of the recent reversal of Roe v. Wade, where she's recommending that this is the time that the United Methodist Church and members of the local congregations become activists, and it's critical that they join in standing firm in supporting the right of all persons to exercise their fundamental rights to privacy, liberty, and equality, and that we become activists and join in, she said, therefore be it resolved that the United Methodist Church is committed to protecting the right of all persons to receive evidence-based reproductive health care, and that we will continue to work tirelessly to see that meaningful abortion rights are codified at both the state and federal level. At the 2022 annual conference in Wisconsin, I used the Cal-Pac template to get a resolution passed that we support comprehensive reproductive health care in our state and rejoining the Religious Coalition for Reproductive Choice. And it passed 72% in Wisconsin. There's one other resolution by another individual that I thought had some good language in it, but I don't think that it's necessary to pass that. It would be good to maybe add this, that Methodist and your churches will support a person's right to reproductive health care, including abortion, through personal prayer, letter writing, campaigns to their legislators, and when necessary, peaceful protest. And I think we need to tell our members advocate and learn how to be good advocates. I'm the social action chair for Wisconsin United Women in Faith, and we have a social action day every April, and we're teaching our members how to be more active in the legislative process. I also submitted a petition this time. I'm a newbie. I'm just a provisional first alternate to jurisdictional in North Central, but I'm learning this process very quickly. And I submitted a petition because everywhere in our social principles, it says that in order to prevent abortions or in order to bring good health to all sexually active people, that they should have sex education. However, the United Methodist Church doesn't really have a program. I am a certified facilitator now for Our Whole Lives, and this is a comprehensive, age-appropriate, culturally relevant sex education curriculum for children, youth, and adults, inclusive of reproductive health rights and justice, and supporting a theological understanding of health and stewardship for our bodies. I presented this in 2022 also in Wisconsin, and it passed 78%. The rationale for this is that we don't have a comprehensive, inclusive sexuality education curriculum for the lifespan, and this program is a nationally recognized program with a faith supplement from the UCC and UUA churches, whose national leaders welcome the United Methodist Church to adopt this program and write our section for the faith supplement. And I've been working with Amy Johnson and Melanie from their churches, and they would absolutely welcome the United Methodists to use that program and write our section for the faith supplement. There's one other
Thank you,
petition
Kathy.
on, yes,
Thank you.
okay, that's the last one.
Thank you, Kathy. Thank you for reminding us about the importance of choice. It's truly godly. And I look forward to hopefully seeing some of these things passed, because in the last general conference session, we've actually gone backwards on these issues.